Hi everybody, welcome back again. Dr. Lee Coleman here. And if you've been following our discussions, you know that most of the time we've been talking about problems which have been around quite a long time, not necessarily current issues. But this time I do want to talk about the terrible violence that our society is experiencing and the kind of suggestions that you hear sometimes asking psychiatry once again to help us deal with this problem of violence by somehow finding the people who are the ones who will do such a thing and prevent such terrible tragedies. Wouldn't we all like to have a way to do that? And we're so used to turning to psychiatry that it's just kind of a knee-jerk thing. Well, I can tell you that I've been involved in that subject for a long time before the current situation that we're in. Going back to the 1970s, I was involved in work where there was an effort to set up research centers to try to pick out people in the state of California who were potentially dangerous. And then a variety of measures were being recommended. This was particularly at the UCLA Medical Center, where some research was being proposed to be done on mental patients and prisoners. I'm happy to say that my colleagues and I, were able to convince the Federal Law Enforcement Assistance Administration not to fund that program. But the arguments then were all the same. If we just develop our technology a little better, we'll be able to pick out the dangerous ones. And we, in our prison system, we still try to do that, and we tailor sentences which hold people for a period of time which nobody knows what the right amount of time is. So to demonstrate to you and to bring the perspective on it, I want to read something to you which I wrote in the book The Reign of Error, which was published in 1984. That's quite a long time ago now. And I addressed the issues of why we should not turn to psychiatry to help us with this problem of reducing violence. Not only because they don't know how to do it, and the evidence is very clear, but we will actually be further behind if we try to do it, because in the process of turning to them, we will not be considering other things that are more legitimate. So if you will permit, I'd like to read this to you to indicate that we have a track record that we can consult, and it tells us don't use psychiatry. Here's a different approach. So I wrote in the conclusion to the book, divorcing psychiatry from all state authority might encourage us to develop genuine solutions to these problems. Without psychiatric pronouncements to disguise our ethical and social problems, we might be more willing to start the long and painful process of real social change. Let us consider the problem of violence as an example. Once we give up the idea that rehabilitating criminals will reduce violence, then perhaps we will seriously approach the problem from the more valid economic and political rather than medical perspective. Instead of trying to protect ourselves from violence by expecting psychiatrists to detect and treat dangerous persons, we might focus more attention on those dangerous situations that we could alter. Situations. Most murder victims in America, for example, are killed by people they know, not by criminals. The murderers are friends, lovers, or neighbors. I believe it is the ready availability of handguns that escalates family or neighborhood disputes into lethal violence. We are concerned about our appalling murder rate, yet we do nothing about the weapons that flood our society. The medical community teaches that alcoholism is a disease and spends millions of our tax dollars each year for research on its causes and cures. Yet this approach has been a failure. Moreover, it is likely to encourage problem drinkers to assume a passive and non-responsible attitude toward their drinking. Patients, after all, are not ordinarily held responsible for their diseases. This disease model is good for doctors, but bad for society. It does not help alcoholics confront their addiction or help society confront its role in promoting alcoholic excess. This model, in fact, encourages society to ignore those policies that might reduce the problem. Why not, for example, ban all advertising on alcoholic beverages? And if I may add, without right now not reading, just like we did with smoking. And look how much progress we made. So back to the book. Why not make a 30-day jail sentence mandatory for first offense drunk drivers? Second offenders would go to jail for 1 year and lose their driver's licenses for 5 years. Third offenders would go to state prison for 5 years. The point is not to control drinking with jail sentences, but to control drunk driving with penalties that send a clear message to our people. Many who drink and drive are not alcoholics and will control such behavior if the penalty is sufficient. We glamorize alcohol at every turn and should not be surprised when it comes back to haunt us. Consider, for example, the fact that half the deaths due to crime and accidents are alcohol-related. As long as we cling to the hope that a better criminal justice system will reduce violence and a better mental health system will reduce mental disorder or alcoholism, we will be less likely to initiate those social and economic reforms that could reduce the problems. So, my message now is exactly the same as what I said then. Don't turn to psychiatry to change society, either by force or even voluntarily. It's not going to happen. We cannot reduce violence by psychiatric predictions. We know that they don't know how to do it. We know that they will vastly overpredict, and therefore we will not be able to find the people in significant enough percentage that we will reduce the rate of violence. What we will do is further antagonize troubled people. They will pick out a lot of people who have problems, but will not necessarily be the ones who would do anything. But those people will now be even more angry about their life than before we made such a prediction. If we want to do something about a social problem, then we must examine the social conditions, the policies, the laws that we pass. And the last thing we need are psychiatrists or any other mental health professionals to do that. We have to have faith and belief in our democratic system of social reform and do it one step at a time, and save the therapists to work with people who want the help and will accept it. And in the criminal justice system, we can offer help to people who are locked up or serving some kind of a penalty, but not try to force that help on them. Why wouldn't we offer help to people just like if they were not in there? But that is not the same as trying to use those professionals in a way that they cannot help us with. Thank you very much. See you next time.